Hey everyone, my name is Brendan O'Morrow. I'm the Vice President of Strategy at Students for Life of America. I'm coming to you today from the beautiful capital of Minnesota here in St. Paul. Wanted to take a few minutes to talk to you all about what's happening in Washington, D.C. with healthcare reform, explain the process and what this means for us as a pro-life movement. Two real important things to know about this as it's being done through the reconciliation process. The first is we only need a simple majority to pass in the Senate rather than the filibuster-proof 60 votes. Second is that everything in here has to be budgetary in nature. So we've got two very big priorities for the pro-life movement. The first is defunding Planned Parenthood. The great news is the bill that was passed by the House defunds Planned Parenthood. The draft that was released for the Senate last week defunds Planned Parenthood. And how this works is you have Medicaid money that goes to the tune of about $400 million every year to Planned Parenthood. This bill blocks that and redirects it to the community health center program. These centers are designed to serve people in communities across the country. They offer a full range of health services, unlike Planned Parenthood, and they don't commit abortions. So this bill provides an additional $422 million to the community health centers that wouldn't otherwise be going to Planned Parenthood. We think we have the votes. What's going to happen is either Senator Collins out of Maine or Senator Murkowski out of Alaska, both Republican senators, are going to introduce an amendment on the floor when the overall reconciliation healthcare reform package comes to the Senate. They're going to introduce an amendment that would remove this language to defund Planned Parenthood. At which point there will be a vote. Again, we only need actually a tie, so 50 votes will do it to defeat that amendment. What we want is for senators to vote no on that amendment because, again, that amendment removes the language defunding Planned Parenthood. Right now, we only have, by best estimate, about 50 votes. So it's really important, especially if you live in Maine or Alaska, if you live in West Virginia with Senator Manchin, if you live in Pennsylvania with Senator Casey, if you live in Indiana with Senator Donnelly, some Democrat senators who have been pro-life in the past. Really important to call them, tell them to defund Planned Parenthood. So politically, we're still working on it, but from a procedural perspective, we are good on defunding Planned Parenthood. That's in the bill. We know it will pass through the reconciliation process because it was done in 2015. Where things get a little bit more complicated is preventing our taxpayer funding from being used for abortion. Now, what most people are going to say right now is, what about the Hyde amendments? What's really important to remember about the Hyde amendment is that it's not a blanket ban across taxpayer funding for abortion across the entire federal government. It only applies to money coming out of the Department of Health and Human Services. It primarily is used for Medicaid. So the Hyde Amendment doesn't cover the budget reconciliation bill. So we have to put language specifically in this bill that would cover all the different types of funds that are created coming from the federal government back to the American citizens that could possibly be used to pay for healthcare coverage, to make sure that the money cannot be used to pay for abortion. So we're working on a few different options that can be used to, again, prevent this taxpayer money from going for abortion. What we're currently working on, and what's in, again, the discussion of the discussion draft of the bill, is something in the short-term stability funds. Now, these funds are actually going straight from the federal government through the states to the insurance companies in order to encourage them to decrease the cost of their plans and get them back on the Obamacare marketplace exchanges that are rapidly failing. And so that money in the short-term stability fund goes through the S-CHIP program. Because S-CHIP money already comes out of the Department of Health and Human Services, it is already covered by Hyde. There's still a few things that need to be worked out behind the scenes. I can't really go into the details. There's some negotiating, some back and forth, some double checking, some triple checking to make sure that this will work and this will hold true to prevent taxpayer funding for abortion. So as of now, this is good, but as pro-lifers, we're not quite ready to say that we support this overall bill because we're still not 100% sure that A, these provisions are going to be able to remain, and B, that it's actually going to accomplish everything that we need it to accomplish. Now, why wouldn't it remain? I'll explain real quick. The Senate parliamentarian takes a look at every single thing that's in the entire reconciliation bill and has to make a decision. Does this have an impact on the budget, which both of these do? And is this primarily budgetary in nature, or is it policy? And that's up to the parliamentarian to decide. And that's some of what we're trying to work out behind the scenes through Senate Budget Committee and Senate Finance Committee. So what does this mean for you, pro-lifers all across America? What do we need to be doing? We're expecting a vote in the Senate this coming Thursday. That's what Senator McConnell has said, the majority leader. So we need everyone to be calling their senators and telling them two things. First, defund Planned Parenthood. Redirect the money for Planned Parenthood to the Community Health Center program. Second, no taxpayer funding for abortion. Call your senators every day. Get your friends to call your senators, people you go to church with, people you go to school with, your neighbors, everyone you know. Get them to call their senators, tell them defund Planned Parenthood and no taxpayer funding for abortion in the healthcare reform bill. So after the vote happens in the Senate, hopefully this week, again, assuming we can get all of this worked out, it's going to have to go to what's called the conference committee, because what the Senate is going to pass is different from what the House already passed back in May. So the conference committee essentially merges the two versions of the bill together to get something that they all agree on. This is Senate and House, Republicans and Democrats come together with one bill that then gets voted on in the Senate and in the House. And that will hopefully happen before the end of July, before they go on August recess. And that's the bill that will go to the president for his signature if it passes. This is something that we as a movement have been working so hard for so long, and it's really the next domino to fall in ending abortion in our country. This is huge. So it's really important that pro-lifers everywhere, every day, call your senator no matter where you live. Call your senator, tell them to defund Planned Parenthood, tell them no taxpayer funding for abortion in the healthcare bill. This is a huge moment for us as a pro-life movement to be able to stop sending $400 million a year to Planned Parenthood, for us to be preventing taxpayer money from going to abortion. This will decrease the number of abortions in the United States. So important for each and every one of you every single day to call, call, call. Thank you so much for all the hard work you've put in to getting it this far. Thank you so much to everything you have done to get us to the point of having a pro-life majority and having a pro-life president. I'm Brendan O'Mara with Students for Life of America. Again, go out right now, call your senators.